We'll go ahead and begin now, just so everyone knows this meeting is being recorded. And please keep yourselves muted until it's time to introduce yourselves. So welcome everyone, and thank you all so much for being here today for our third Tobacco Prevention and Cessation Coalition meeting. If you have not put your name in the chat box, please do so. And we will now just jump right into introductions and sharing. Every attendee will be called on and asked to briefly introduce themselves. Briefly introduce yourselves, and if you have any agency announcements you'd like to share, feel free to do so. You can also put those announcements in the chat box, and I will make sure they get distributed out. I'll go ahead and start us off. My name is Melina Rivera, and I am the Tobacco Program Coordinator at Healthy Communities of LaPorte County. My updates will be embedded throughout this meeting, so I'll just pass it right along to Rose. Would you like to introduce yourself and share any announcements you have?
Good morning, everyone. My name is Rose Marie Joyner. I am the outreach specialist for Healthy Communities of LaPorte County, and I also oversee the Tobacco Prevention Cessation Program for the youth component. I'm very excited to be a part and participate in the Tobacco Coalition meeting today. I do have, is now the time for announcement? Yeah. Okay. So I do have one announcement, and I'll let Rashana give the other announcement. We are currently interviewing for a part-time tobacco coordinator for the voice component for the youth. This is a part-time job, and if there's anyone that would like more information, I could send you the job description. Just put your email address in the chat box, and I'll be more than glad to send that job description out. As a result of us really working to improve our numbers, we really need to just have one person that is dedicated to the tobacco prevention cessation, as far as working with our young people in middle school and the high school component, as far as LaPorte County, Michigan City High School, and LaPorte High School as well, and other youth serving agencies that may also be located in LaPorte County. Thank you.
Thank you, Rose. Rashana?
I'm Rashana Hood. I'm an enrollment specialist with Healthy Communities of LaPorte County. Right now, an announcement that we have is our outreach events that are going on. We have 2 that'll be in LaPorte County, 2 that'll be in Porter County, and 1 that'll be in Lake County. I'm going to attach a link to the flyer in the chat box so you guys can review it. If you know anybody who's interested in coming, or if you know anybody interested in participating as a vendor as well, you can just reach out to either me or Rose, and Rose's contact is on the flyer as well. But it's just going to be an event to do open enrollment. People can change their MCEs at this time due to the open enrollment, and then we're also helping marketplace applicants. We'll have some people there also to assist with Medicare questions. And we do have some vendors already that are confirmed, such as Minority Health, WIC, Nurse Family Partnership. So definitely let me know if you're interested. And I'm going to also include a link to the flyer in the chat box.
Thank you, Rashana. I will also attach that flyer to the follow-up email for this coalition meeting. All right, let's call on Christine.
Good morning, I'm Christine Rosenbaum, and I'm the mental health counselor and prevention educator at LaPorte Community School Corporation. And it's kind of funny, we're meeting right now because right before our meeting, I was working on a project. One of the high school health teachers asked if I would go to her class tomorrow and talk about vaping. So I'm excited about doing it because, you know, a lot of youth think they know everything there is, and they can't learn anything. And so instead of me just standing there talking to them, I'm going to be asking them questions about vaping. So I'm looking forward to that tomorrow.
That's wonderful, Christine. Thank you. Debbie.
Hi, good morning. My name is Debbie Smirtelny, and I'm a nurse with Northwest Health LaPorte Hospital. And I do a multitude of things here. I'm a research nurse. I help with cancer registry and the oncology program. We do a lot of preventative things regarding cancer screenings. And one of the things is I'm a certified stop smoking facilitator, and I currently am running our lung nodule program where we are trying to encourage low dose CT scans for smokers in our community. Thank you.
Thank you so much, Debbie. Lee Morris.
Hello, everyone. I'm Lee Morris. I'm just a miscellaneous volunteer from LaPorte and very supportive of this initiative.
Thank you so much, Lee. Denise Carpenter.
Hi, my name is Denise. I am the Communication and Engagement Manager for North Shore Health Centers. We have recently moved in LaPorte, actually. So we are at 508 Legacy Plaza now. We have medical, dental, we have substance abuse. We do have the quit line embedded in our EHR, but I know that we are now able to see so many more patients because we have a bigger area. So we are definitely excited about being able to offer a little more tobacco cessation now in LaPorte County as well.
That's amazing. Thank you, Denise. I do think that was everybody. Did I miss anyone? All right. Thank you all for sharing. And I'm happy to see some familiar and new faces. All right, so now I just wanted to share this slide again. I've shown it in the past 3 meetings. But this slide is just to remind you of the work that this coalition will be doing. So the pieces in dark blue are our 4 priority areas, and the pieces in green are the community indicators we'll be doing work under to reach our goals. So hopefully this gives you a bigger picture idea of the work we will be doing together as a coalition. And this is also another reminder. I wanted to remind you about the subcommittees. I won't go into much detail, but here are the 4 subcommittees we are hoping to form. And we do have 5 coalition members interested in joining one of these, but we are looking to still finding more members to join. To the right are the expectations of the subcommittees. And this is just in case you're not sure if these are a good fit for you. Here are some of the expectations. If you are interested in joining a subcommittee or know someone who might be a good fit, or even just have questions about them, please let me know and I'd be happy to answer those. Okay, so now let's jump into deliverable progress. Last meeting, I asked you all for help with some of these upcoming deliverables, which are listed on the slide here. I did get some help with some of these, so I'm very thankful for that. I'll go through these and just give you some updates on them. So starting with smoke-free multi-unit housing, I asked your help with connecting to local housing authority and other housing agencies. Lee Morris helped me with this. He connected me with Dahlia Zygas, who then connected me to Michael Mack, who's the Michigan City Council President and the liaison for the Housing Authority. And Dahlia also connected us with Angie Nelson, who is also a City Council member, and she chairs their Public Health and Safety Committee. So very excited to be in connection with these 2 members. I emailed them both, and I did hear back from Angie Nelson. who wants to meet with me to discuss it further. So right now I'm scheduling a meeting with her to talk about how we can get more multi-unit housing to go smoke-free and support their residents with quitting tobacco products. Next, for tobacco-free work sites, that's our policy indicator. I asked you with help in completing the community readiness profile document. As a reminder, it's just a document with questions about our community that we need to answer. And based on our answers to those questions, we'll get a better sense of our community's readiness to get a local ordinance passed here for smoke-free air. And it'll help us give direction on kind of strategize for how we want to start moving LaPorte County in the smoke-free direction. Any bit of help on that document is much appreciated. I created a Google Doc, and so I'll be sending out a link to that so we can all kind of work on it together. Any help is appreciated. I'm still within my first year of this position, and not only was I new to this position, but also new to LaPorte County. So having help from those who worked in this community for much longer would be wonderful. Moving on to coalition building. I asked your help with identifying prospective coalition members. Tay Lethbridge, Christine Rosenbaum, and Lee Morris have all suggested organizations to me to reach out to join our coalition. As a result of that, I attended the drug-free partnership meeting in November and promoted our coalition there. I also sent our coalition recruitment flyer to Healthcare Foundation of LaPorte County, who leads the Partners in Prevention initiative. And they go out into schools and do evidence-based drug and alcohol education to students. So they may be a great fit for joining this coalition. So I did send them the recruitment flyer, and I'll also send it to you all if you want to share that with anybody you think might want to join our coalition. And we've also gained some new Northwest Health members to our coalition. So thank you, Debbie, for being here. All right. Oh, a few more. So for marginalized populations, I asked your help with identifying agencies to give a presentation to about tobacco burden on different marginalized groups. It kind of worked out perfectly a few weeks ago. The PFLAG organization from Crown Point, but they oversee Northwest Indiana, so also LaPorte County. They reached out to me wanting quitline information. And so I scheduled a meeting with them, and through that meeting, we scheduled for me to go deliver a presentation on the quitline to their clients in a support group. So that's exciting. And then for employers, I asked your help with identifying employers to give a presentation to or have a meeting with to address the burden of tobacco on employers. And that's including quitline promotion, tobacco-free grounds policies, and more. Lee Moore suggested reaching out to occupational health contacts at Beacon Health System and their joint venture with Franciscan, and also Northwest Health. I'm waiting to hear back from Beacon Health joint venture, but I did have a phone call with Northwest Health and their contact, Leslie Schroeder. She gave me a lot of great insight to how we can communicate with employers on this kind of topic. One particular thing that I didn't even think about was she kind of told me that because we're in a pandemic and the workforce is kind of struggling right now, she said a lot of employers might be hesitant to having a tobacco-free grounds policy because they're trying to steer away from pushing any employees from quitting and things like that. So that's really good insight. And so maybe I'll not be so persistent with smoke-free grounds policies, but definitely promote the quit line and helping their employees quit tobacco products. She also referred me to Katie Sarver, who is their wellness director, I believe. And She does a lot of tobacco cessation, and I reached out to her and we have a meeting scheduled to talk about how we can partner. So that's great news. Finally, I scheduled a presentation with an employer called LaPorte Seamless Gutter, and they want to help their employees go smoke or quit tobacco products. So I'm doing a presentation for them on the quit line as well. So some progress being made. Thank you to everyone who helped me with contacting people. And now I want to talk about a new set of upcoming deliverables. Some of these are the same. So for the quit line, monthly, I do outreach to healthcare providers to promote the Indiana Tobacco Quit Line, get them to become preferred providers so that they can then have all the resources they need to help their patients. So my question to you all is, who should I reach out to in terms of healthcare providers to really promote the quit line? I can train them on it, show them how they can refer their patients, etc. So I would love your help with who I should reach out to for that. Also, tobacco-free work sites and our policy indicator, that community readiness document. If you can help me fill that out, that'd be great. I'm sending out the link soon. For coalition building and marginalized populations, we need to conduct an assessment of our recruitment and development, and also our engagement of marginalized groups in the community. So my question, I have to fill out a document and submit it to my state liaison. And the question I want to ask you all for help on that is, who are our marginalized populations and which agencies work with those populations? So then I can begin to outreach to them. And finally, I have on here for coalition building is to complete at least one earned media submission. So that could be a letter to the editor, an op-ed, or a news release to a local media outlet. In the past, I've been the one writing them and submitting them. I've reached out to the News Dispatch or Herald Argus, and I've been submitting them monthly, basically on any tobacco prevention or cessation related topic. For example, this month is the Great American Smokeout that the American Cancer Society founded. And it's just a day where people can commit to quitting tobacco products. And so I kind of leveraged that campaign and wrote a little like LTE on it, and then promoted the quit line at the very end. So that's just an example of what I've done in the past. So if anybody is a good writer or just wanting to, educate the community on a tobacco related topic, I'd love your help with that. So let me know if you're interested in helping write a media piece. All right. So now let's move on to our professional development topic today. Today we're going to talk about how tobacco is a social justice issue. Our state is working to advance fairness and justice in health, especially with tobacco prevention and cessation. Justice involves addressing major causes of inequalities, like the harm that tobacco causes in communities of color, lower income communities, and more. Tobacco is not an equal opportunity killer. And in the world of tobacco, the tobacco industry does a great job at masking their unjust tactics. And I really wanted to bring some of those manipulative tactics to light today. So I'm going to play 4 very short videos. They're under a minute long each. I'm going to play those for you. Each are focused on a vulnerable community that the tobacco industry heavily targets. Because these videos are so short, I'm going to play them all back to back, and then we can have a brief discussion on them after. I apologize if the audio is not the best quality, but you should still be able to make out what they're saying. So let's try these videos out.
For decades, Big Tobacco targeted minorities with menthol cigarettes. Here's some of what they did. Identified and profiled Black communities.
More than 75% of African American smokers use menthols.
Appropriated Black culture. Flooded the neighborhood.
Can't get away from it. It's all around us.
This addiction was designed.
We grow cigarette volume, and that's all we did.
And today, 89% of African American smokers use menthol. Know the truth, spread the truth.
That was how the tobacco industry targets the Black community.
I'm in DC.
Now let's go on to lower income communities.
A staggering 72% of remaining smokers come from lower income communities, and young adults have the most to lose. Yet we see from tobacco industry documents, they describe them as less educated and having nothing to look forward to.
There's so many examples of how that is false.
They don't think we will make anything of themselves.
Just because they see you that way doesn't mean you have to be that way.
They're looking for people who are in a tough spot. That to me is as low as it gets.
But big tobacco isn't just insulting them. They're pushing them a product developed to keep people hooked. They genetically engineered the tobacco itself, and it hits struggling communities the hardest.
I don't care. They don't care about us.
My goal is to be someone who they didn't think I would be. Our hardworking communities deserve a future. We can't let big tobacco take that away.
We're still people. We're still human beings. It has to stop.
Know the truth, spread the truth. Enlist at thetruth.com.
So that was on lower income communities. And finally, I'm going to show you two videos on the LGBTQ plus community and how the tobacco industry targets them.
This is my friend Donald.
According to recently uncovered documents, a well-known tobacco company planned on boosting sales of cigarettes in the mid-90s by specifically targeting gays and homeless people. What did they call the little plan? Project Subculture Urban Marketing, also known as Project Scum. But I'm sure they meant that in a good way.
Craziness. All right, I have one more on that same topic.
Do you believe this?
Are you serious?
Because gay people are scum. Because gay people are scum.
Well, why?
Those idiots.
In 1995, one tobacco company planned to boost cigarette sales by targeting gay and homeless people. They called their plan Project Scum.
Thank you.
That's powerful. That's
All right. So, it went by really quick, but in case you missed it, the text on the screen in the last video said, imagine if the tobacco industry spoke to you the way they speak about you. So tell me, do you think this is just? Probably not, right? Absolutely not. It's pretty clear that it isn't just, and I'm curious to know what pieces stuck out to you from these videos. Anyone would like to share?
I'm actually appalled and speechless.
I know. Same here. When I first started this position in tobacco control almost a year ago, my executive director had me watch some videos just during my orientation to get acclimated to the topic. And I saw that Project Scum one, and I was appalled. Like I couldn't believe that they called that project Scum. Like, what other reasoning could they have behind that? You know what I mean? Anybody else want to share?
I definitely think it's important, the stuff that you're bringing to light. Like I sit on the executive board for the Porter County Tobacco Education Prevention Coalition, and every time we discuss this, I get more irritated by it. So I don't have any other words, but I don't want you to think like it is something that we need to talk about, that we need to be cognizant of, but it's very frustrating.
Absolutely. I definitely agree with you. And I don't think it's talked about enough either, because they just do such a good job with masking these tactics. And if you aren't noticing the targeting, the marketing that they're doing, it's because they're not targeting you. They're targeting certain people in certain groups that are vulnerable. Any other comments? All right, well, I will share these video links in the follow-up email so that you can spread the word to others who may not know about these issues and this unjustness in our society. So I definitely wanted to share these with you. I hope you learned something new or just got more passionate on this topic, because this is real and it's happening. So again, feel free to share these videos. A just society should ensure that no one is exposed again and again to things that we know are harmful. And that's why, as a coalition, we're working on things like removing obstacles that prevent some groups from getting treatment for nicotine dependence, ensuring that smoke-free air policies cover every workplace with no exceptions, and exposing these manipulative marketing tactics that the tobacco industry does and spends billions of dollars doing, especially towards our youth, and so much more. And you are a part of that. So thank you again for being here, and thank you for this really great discussion. All right, let's move on to action items. Just as a reminder, if you can help with these, please send me any healthcare providers I should reach out to for quit line assistance. Let me know if you're interested in helping with the community readiness profile. Send me contacts I should invite to join our coalition if you see that someone's missing, or just want to make sure we're reaching out to the right people. Send me your media submission interest if you'd like to write a media piece. Send me marginalized communities that you think exist in LaPorte County and agencies that serve these marginalized communities, so I can begin working with them. And also let me know if you're interested in joining a subcommittee, or if you know somebody who is. Please get those things to me by December 8th. And this is our last slide. So thank you all again. Our next meeting is Wednesday, December 15th at 10 a.m. I've moved it up a week just because of the holidays. And something to look forward to is we will be having a guest speaker. Her name is Miranda Spritznagel. She is the Director of Tobacco Prevention Cessation from the Indiana Department of Health. And she'll be speaking to us about our strategic plan in Indiana for tobacco control. And the work that we do in our coalition on a local level is based on that strategic plan. So it should be really great information. All right. Thank you all so much. And I hope you have a great rest of your day.
Thanks, Melina.
Thank you.